Hello, my name is Klaus Schustereder. I'm speaking here from Montreux, Switzerland, and I have the honor to be the president of a foundation which has been created with two other people already 5 years ago. And this foundation is called Physis Foundation. Physis is the goddess of nature in the ancient Greek mythology. And the reason we created this foundation is because I had the opportunity to work for a few years in Central Africa, and I got very interested in epidemic disease. And as I have a medical background, and I was working as a medical doctor in a 50-bed hospital in the west of Central African Republic, I've learned a lot about epidemic disease. And the thing is that epidemic disease, the way we treat them in a country like Central African Republic, there are a lot of limitations to the way we do it today, and that we have to rethink the whole approach. So what we basically are doing is that we export a Western concept to a low-income country which is not prepared, does not have the resources, intellectual resources or financial resources and other aspects to implement such an approach like we use them in the West to implement them there. So I came to the conclusion that we have to simplify the treatment of epidemic disease in a country like Central African Republic, and I identified 4 parameters so that an approach can be effective in a country like Central African Republic. And these 4 parameters are, first of all, an approach has to be cheap. It has to be cheap, and it has to be effective, of course, and it has to be safe, and it has to be simple. So these are the 4 parameters which are the base so that we can reach as much people as possible. And while I was working there, I saw that people, like anywhere, learn very quickly when they're motivated. And one of the challenges in Central African Republic is that there is an absolute lack of doctors, especially in the rural parts of the country. So you have to teach nurses or health workers to use medication, and that's conventional medication. Of course, there is a problem because conventional medication, pharmacological approaches have potential side effects. So the best way is to have something that is not toxic at all. So that's why the safetiness is so important, as I just mentioned. And in 2005, I came in touch with I think an absolutely revolutionary approach, which is information in water. It's disease-specific information which can be put into water through an electromagnetic signal, and that has an immune modulating effect. And that was very, very difficult for me to believe at the beginning. But over months, I saw that this is really doing something with patients, and there is disease-specific information for different diseases like malaria, hepatitis, tuberculosis, AIDS, and post-traumatic stress. And now I'm involved in this kind of research since 15 years. And the great thing about this approach is not just that it is safe and simple and effective and cheap, but the great thing is that you can build a new business model for clinics which gives these clinics a lot of independency. Because you have to understand that in these African countries, most African countries, let's come back to Central African Republic, the doctors and the nurses do not get paid regularly by the government. So the clinics have to generate an income, and if you can provide medication which is super cheap and which is effective and which is safe and simple, then you give them the opportunity to generate money through consultations. And we have tested this approach on different health issues like sickle cell anemia, where we did do that in West Africa with a lot of success. And what we have done is we followed up these patients here from the West by calling them from here. We've done something similar with post-traumatic stress in Afghanistan, very effective, and we saw that the people who have experienced massive trauma, like young people coming from the battlefield, have improved very quickly. And of course, the more the trauma is integrated in the person, and let's say the more it becomes chronic, the more difficult it is to treat. So it's important to treat disease as quick as possible in already in an acute state. And so what we see is that we can really build a new healthcare concept on the ground by providing to people a new business model, because the medication is cheap, simple, effective and safe. But we also can build intercultural collaboration by following up people from the West through communicating with them through Skype and other tools or phone to follow them up. And then it's all about how do we do the documentation of these patients. And there are also, due to computer and internet, interesting ideas how to build the record so that people can access the record through the internet, like we also do it in the West. So why wouldn't we do that for developing countries? So there's a lot of potential on different health issues, where the main focus for the foundation is epidemic disease, and it's an incredibly rich and inspiring work we're doing, where we learn a lot about health and disease and the potential of human being, and how even with very chronic situations, children having been sick with sickle cell anemia did improve within a short period of time, and that's extremely fulfilling. And for all those who are interested and all those who want to learn more about it, they can come back to us, and we try to share as much as possible with them, so that we find more people who are interested to make a contribution in this kind of innovative concepts we try to develop.